Welcome to Recovery Radio with Mr. G, the recovery broker, right here on WEHA, Gospel 88.7 and 99.9 FM, your number one station, where our goal is to help save a life in a world plagued by drugs, alcohol, suicide, depression, and addiction.
Good morning. Welcome to Life Recovery Radio. I'm Mr. G, your recovery broker, on the station for information. I'm here with the director today of Behavior Crossroads. We want to allow him to expound on some of the privileges and opportunities that people will have in our community to bring their loved ones onto a new road of life. My guest today is from Michael DeMarcos, and we have from Crossroads, Mr. Michael DeMarcos. Mr. DeMarcos, tell us a little something about Crossroads, its intents and purposes, and what it's doing right here in the community today.
Thank you, Mr. G. Just to be clear, Michael DeMarco. I'm with Behavioral Crossroads. I'm the director of admissions. Been with the agency over 9 years. Behavioral Crossroads has been in Egg Harbor Township about 13 years. We're licensed as a mental health partial care program for the last 13 years. In the last 5 years, we got licensed as a substance abuse treatment provider on an outpatient level. Behavioral Crossroads Recovery is 5 years old, offering services in ambulatory detox, substance abuse partial care, substance abuse intensive outpatient or IOP, and general outpatient. And we also, in the last 2 years, opened up a Turnersville location with the same substance abuse treatment focus. The agency accepts grant money in Gloucester County. We're one of the rare agencies that accepts Medicaid through the Affordable Care Act for substance abuse primary outpatient services. We accept Medicaid for all mental health related services. We're in the fee-for-service network with the state of New Jersey, so we accept funding through the DUI, which is Driving Under the Influence Initiative, through MAP, which is state parole, through the drug courts. We also have contracts with DCP&P, so the Division of Child Protection and Permanency, formerly known as DIFAS. We're in network with almost every major private insurance company, and we also work with out-of-network benefits for private insurance.
Beautiful, Mr. DeMarcos. We're going to elaborate a little more on that and those things that you're doing back in Crossroads and all the association that you have to help people in our community. But what we want our listening audience to know is that we're a station for information. Our purpose here is to allow our surrounding community the opportunity to have people such as yourself come onto the show and elaborate on being able to find the necessary help that those that are in addiction or in mental situations, whether it be a family member, a friend, someone on the street, it's a bigger purpose here. And I thank you so much for taking your time out today to be a part of my program. Thank you so much. Would you please elaborate?
Yeah, thank you, Mr. G. I can speak in terms of South Jersey. I can speak in terms of Egg Harbor Township in Atlantic County. We're one of many agencies in the community. If someone needs general information, New Jersey has a wonderful hotline called 211. Anywhere in New Jersey, if you pick up any telephone and dial 211, you're going to get the Mental Health Association's liaison agency for recovery and connection, and they can look at the logistics of where you are in New Jersey and cite you a relevant resource to help you. And there's also live trained individuals that can guide you. In Atlantic County government, there's actually a substance abuse department by Bob Wittitz and Doug Mercer work for Atlantic County government. If you dial Atlantic County government and ask for substance abuse, you can find out what funds, what resources are available for other agencies in Atlantic County, and they can make those contacts for outpatient or inpatient services. The county actually has funds available for contracted agencies and has a list of licensed agencies that have affiliation agreements with the county. We have a similar relationship in Gloucester County with Gloucester County government. Judy Tabia Johnson is the substance abuse coordinator for Gloucester. John Pellicane is the substance abuse coordinator for Camden County. Juanita Navarro is the substance abuse coordinator for Cumberland County. And I guess I'm Pat Devaney is Cape May County, and that kind of represents South Jersey.
Fantastic. We appreciate that information and direction. I want to try to stay local within your facility because I'm in Atlantic County and this is the surrounding area. Your program for the community at large, what capacity and goals have your program seen really works since you guys have been there in that location?
Well, to be honest with you, we're going to work with anyone who's eligible for treatment, and we're going to meet them where they are, Mr. G. And I say that because in recovery, beauty's in the eye of the beholder.
Yes.
And I think the individual has to want to be helped in order to achieve that goal. We've seen clients come to us and after extended care do relatively well without extended relapse situations. We've also had clients that have failed with us, and we've had clients that have re-enrolled with us 2 or 3 times, sometimes 4 times.
Yes, well, we know that's a part of the process for so many people, unfortunately. But the very fact of the matter that there is a facility that they can turn to, such as yours, Behavior Crossroads, it really makes a difference in the community. And how do I know that? I am a recipient, an alumni of your program. And I do know from firsthand experience how going to Crossroads has really helped change my life and give me a direction and purpose. One that exceeded my own expectation, so I understand why it's necessary for the people in our local community to know that there is a way out, because after all, this disease is not limited or restricted to one particular person, people, etc. It has no prejudices. So what we're trying to do here is inform people and let people know firsthand information that there is a way out regardless of the situation, regardless of circumstances. We want you to know that there's facility, there's people out here that's willing and able to help you and lead you and direct you in the right direction to get what's needed. As I stated, I'm a very proud recipient of your program, and your program has truly changed my life. I thank God for being able to have you here today. This is my first show, and to have people that was very meaningful to me in this destiny and this travel of my life to this point to get me to where I'm at today, I am extremely grateful. With that being said, in regards to your, tell me a little bit about, not so much about the substance abuse treatment, but what is the purpose, exactly what's the purpose of the substance abuse? Because it's there because you guys see the need for it to be there. I understand that it's a mental facility, but it's also a facility for substance abuse. And what's going on in that department, not from a clinical standpoint, but just because it's there, what have you witnessed firsthand that have seen people's lives change?
Well, first of all, thank you, Mr. G, for taking your recovery so seriously.
Thank you.
And I, as a liaison or a representative of Behavioral Crossroads, don't want to take credit for your success. I want to put that back on you.
Thank you.
I'm sure it was a very long road.
Yes, it has.
It was probably a serious and significant struggle that you're going to be living with for a very long period of time. And you're sober, you're living clean, and you're in recovery.
Yes.
And we're just one step on that path. You found the light, and your recovery is significant. I don't know that our agency or any agency can take credit for the realizations that you faced, the mirror you stare into every morning. But thank you very much.
You're so welcome.
You want me to talk about our substance abuse program?
Yes.
Okay. We have a unique substance abuse program in a couple of different facets. We're one of the agencies that can accept or work with most individuals. Our substance abuse curriculum is unique in that there's only, that I know of, 2 licensed ambulatory detoxes in the state of New Jersey. Ambulatory detox is otherwise known as outpatient. So it's level 1 or level 2 WM. WM stands for withdrawal management. So these are individuals that, in the short term, alcohol 3 to 5 days a week or opiates 5 to 9 days a week, can come in, be medically monitored by who we believe the leader of substance abuse detox in the community, Dr. James Menlandro, who has been working with Atlantic Care Shore Memorial Hospital.
Very well known man.
Right,
Yes.
for 40 some odd years.
Yes. I would like to change gears now. I also have with me another guest. It's Robert S. Mr. S is a real estate agent right here in Atlantic County and surrounding areas. Also, a part of recovery. I would like for him to give us a brief description of what he has come from, his challenges in life, and where he's at today. Mr. S.
Thank you, Mr. G. Thanks for the introduction.
Yes.
Again, my name is Robert, and I'm here today both as a member of this business community, and I'm a little support here from my good friend, Mr. G. What brings us here today is he's sharing his message of experience, his strength, and his hope with regards to recovery. And thank you, Michael, in advance. It was my pleasure meeting you, and your dialogue's been great. It's been informing as I'm sitting here. So, as Mr. G told you, we are. I'm helping him hub together information for people who have questions with regards to recovery. Where do I go? What resources are available to me? The reason I put these questions out there, we've hubbed them together as we're trying to, because I had the questions myself, finding myself in my 40s with problems that I could not handle on my own in regards to alcohol. I didn't really know where to turn to. I didn't know what resources were available. I was afraid, scared, and confused. And if there was a resource available to hub together information of, hey, do I go to here? Do I go to the Crossroads program? What exactly is a fit for me? I would have loved it at that time. And I think that's what Mr. G's message is here. Am I correct for saying that, Mr. G?
That's correct, sir.
Okay, yeah, so, I mean, it's just basically a hub of information so people can easily, listen, when you're in any kind of mental breakdown situation, anxiety, addiction, you're not thinking clearly. So to have resources that are easily accessible to you really is a huge key. It was a key to my recovery. So that's the message. I'm here to share my road of recovery that Mr. G helped me with. And that's what we do. We're people helping people. So as we help, one person helps the other. We come in, and I'm supporting him on his first broadcast on this lovely radio station to share our message of hope and recovery. And then what our goal is to provide the resources. So if somebody else has the same questions that I found myself asking myself, the answers could be maybe a little bit more profound and a little easier to reach. Everybody has their own method. And like Michael said earlier, that this program is truly for people who want it, not for people who need it.
Are you ready is the question.
That's correct. That's correct. And I'll keep elaborating on. So my little path is, I use some rooms. I use a 12-step program to get myself some serenity and some clarity. And what I do, as we're doing here right now today, is I talk to other people in regards to recovery. And I share my message, they share their message with me. And I really find that the impact of the sharing process of one message to another helps you identify with problems. I'm also a web guy, IT tech guy. So as I was asked to do for Mr. G, as he requested and directed me to do, on the website, which he's established at www.recoveryliferadio.com, www.recoveryliferadio.com. There are some resources such as the Crossroads, as we have Mr. DeMarco here right now. And there's from a suicide hotline to rehabs to drug court to all kind of resources. And if people do call in and send information up, we'd love to always gather information on other resources we can provide for people, because you never know where the help's going to come from. The help comes from sometimes the strangest areas. I'm sitting here next to Mr. DeMarco, and I'm listening to his message, and I'm applying it to my situation as I'm here right now. So, you're never, hopefully in this life, you're never done learning. You're always in the process of gathering more information, and that's our goal: gathering and hubbing information and making the delivery source as easy and comfortable. Yeah, people helping people.
That's a beautiful thing.
I agree.
Hey, Rob, when we think about the life road which we have traveled up until this point, and under the lash of that disease, whether it be drugs, alcohol, we always seem to think that we're alone in this journey. But what I've truly come to find out to be a reality and a major factor in my life today was that there's more people to help me than those that was trying to hurt me, that I found out that I was my own worst enemy. Because under the lash of the disease, we know from first-hand experience that we feel alone, isolated,
Absolutely.
And today, we don't have to live like that. And the purpose of this program is to direct attention to the wider scope of what recovery consists of. It's not restricted or limited to just one particular area. As Mr. Rob has already described, we want to branch this, bring it out, branch it, widen the scope. We don't want people to be limited or restricted to thinking recovery is confined to just one area.
Absolutely. I think when you talk in regards to recovery, I don't know of anyone in my life, and I'm not so young or old, I'm right in the middle there, that has not found themselves, all of us, right, that has not found themselves either with the problem of their own or a family member who has had a problem. I mean, it's a common plague in our society today.
Yes.
These are real family issues, and these are real problems in our society. And to my own personal understanding, ignoring them and suppressing them and not discussing them is the exact opposite of helping people help other people.
That's correct. And the beautiful thing about, once you engage in this process, you learn that one of the most important factors is trying to find a platform to give it away. Because it's nothing as rewarding as giving away or feeling a part of somebody's life and witnessing the people's lives change right before your very eyes. From my own history of being under the disease for many years, 44 years to be exact, I'm not ashamed of where I come from, and I'm proud of who I am today. I couldn't say that just prior, to this process. Only by the grace and mercy of God do I live the life that I live today.
God bless, absolutely.
I keep that first and foremost because I am on a gospel program, and I am extremely spiritual, and I need for people to know who they're talking to, where I come from, and what I'm truly about, And my disease phase of my life, I had a mask. Everything was masked, And this process, you learn to unmask. You don't have to walk in an illusion. You can walk in the reality that life is good when you're good to yourself, And I don't see people today, Rob, I don't know about you, as being my enemy.
Absolutely
I
not.
see this process has made people such as yourself, my friend.
One of the toughest parts about this process is when you find yourself confronted with somebody who's obstructionary or maybe an enemy. Now I can't be mad at you. Now I have to pray for you as well. So now I have to hear your slack and maybe not like it and have to pray for you. So the burden's gotten bigger, but the rewards are most certainly worth it. I'll tell you that much.
No doubt about it.
I'll tell you, Mr. G has had me over to the Crossroads, Michael, where you work, and I'm just going to say this. I mean, I never experienced a program like that. It was my pleasure
Beautiful.
and my honor. And the best part of it was really the barometer of how you can gauge somebody's success in recovery. 2 months ago we went there, you'd see people physically reeling from an illness. A week goes by, and the first thing that cleans up is their physical attributes.
Yes.
And then their conversation. I'll tell you,
It changes.
if you want to see a blessing of God and a program truly work,
Yes, sir.
I mean, I applaud you because
What a beautiful.
it's a calling. It's not just a
Yes.
job. I know that.
Yeah, I
Yes.
appreciate that, Robert. Thank you very much.
Absolutely, absolutely.
With that being said, Mr. DeMarchio, we're not saying or even trying to put you under the gun when we talk about your facility and what are the things that it's done, but it must be acknowledged because somebody needs to know that's going to that facility or any other facility that if you really give yourself a chance, that there are more people there to help you. It may seem that you're there because you're being forced there. But a lot of times, there's a power greater than you that has brought you there, that allowed you to get there. You know, because there's so many of our people in our community that's dying
Absolutely.
because of this disease. A lot of people are crippled because of this disease, mentally insane because of this disease. So this is why it's important that we widen the scope of this thing, to let people know, you know, this disease is extremely detrimental, and we must be pillars in our society today to let them know that there is another way to live life.
Absolutely,
You know?
absolutely.
Do you, Mr. DeMarco, at your facility, I notice you deal with a lot of young people. Exactly where do you recruit your young? Where do they come from? They walk-ins or?
Well, as an agency, we can't really have walk-ins. There's a HIPAA standard of compliance where we have to protect your rights, the rights of any client that's in treatment with us. So, like any doctor's office, everything's by scheduled appointment. We do have a 1-800 number. We do have a website that has an opportunity for people to post a request for an appointment. Our phone number is 877-645-2502. The admissions department is option 2 off the main line. If you're dialing from Atlantic County, it's 609-645-2500. Any individual can contact us for treatment. We do assessments. So an individual will come in, spend about 90 minutes with a trained licensed counselor to do an assessment. The individual will go over a psychosocial history, a substance abuse history. They'll review, the individual's prior treatment and ask a number of different questions based on that person's profile. And depending on the significance of their illness, will be assessed to a certain level of care based on ASAM criteria. Our agency can only support the lowest level of care, which is outpatient, to our highest level of care, which is the outpatient detox, the ambulatory detox. So we're not really working with any client that's actively using. Unless it's opiates or alcohol, we can detox them.
Beautiful.
But if a client comes to us with an addiction for something significant or mind-altering or threatening to the body, like benzodiazepines, where they might have issues of seizure or low blood pressure, and there's medical risk factors, our assessment will make a referral to an outside agency that has inpatient for an extended stay, probably 14 to 28 days. Recovery for an individual is their ability to see it. So, when Robert, when you're mentioning seeing how individuals are recovering in treatment with us, it's very nice to hear. The court system or justice-involved clients, they're mandated into treatment in lieu of jail. There's a wonderful, wonderful system called
it
drug
is.
court.
Yes, it is.
Where
Works,
the
yeah.
state Yeah.
You can see it working. I mean, it's
It
just
works, no question
Well,
about it.
it's a win-win on so many levels.
Yes.
The government is struggling with finances. We need to give people hope. We
Yes.
need to give people treatment.
Less incarceration, more
But
treatment.
but if it costs $50,000 to $70,000 a year to incarcerate an individual, and if they're in jail because of a crime or an offense that's directly related to their substance abuse issue,
Substance abuse, yes.
why not put them into treatment linked to probation, which is what the drug court model does?
Yes.
And depending on the assessment and the level of care, now you have individuals that the state of New Jersey is paying $13,000 to $30,000 a year for,
That's correct.
and they're stepping them down through all appropriate assessed levels of care, from inpatient.
absolutely. I'll tell you, I've met some of the people on the street outside of the Crossroads program after being in the program,
Yeah.
and it's just amazing because a lot of this, the process of recovery is information and education. And I see people on the street. I was washing my car. Kid walked up to me, scared the death out of me. Hey, Rob, how's it going? When you coming back?
Yeah.
And just the information. Where do you go here? What do you do?
That's right.
It's they're just the thirst and they're starving for
Make
information.
it available.
And by the way, if I may, I thought I was a drunk and an alcoholic. You've had such a profound explanation of what your program does. I feel so much more sophisticated now, and but I've heard you dialogue, and it's great. But again, yeah, I mean, just the people. I don't want to call them students, but the clients that you have.
Beautiful.
I mean, the information you can see. Listen, I think in this disease, people feel left out in the cold. And when
That's
somebody
right.
knows there's somebody else out there as you are,
That's
their whole entire, they stand up straighter,
Life
their face lights up, and I see it.
Yes.
I see people, with their shoulders stew rather than slumped over. Very nice, very nice.
That's beautiful, Rob. My mind was going, as you were sharing, Mr. DeMarcus, my mind was going back on in my lifetime past, how I felt, you spoke somewhat on the order of jail compared to the program setting today,
Right.
I'm one of the guys that come up and I was always going to jail. And unfortunately, the programs that we have today was not so available at that time.
Right.
Today, at least, we do have in place a system that recognizes that the usage of drugs today is a mental just as much as
Physical, sure.
physical problem. You know what I mean? Because
Yeah.
I know in my own mind, in my years of addiction, I was my worst enemy. And it was a mental state that I thought I could never change until I began the road of this process.
Right.
This process has changed my life in ways that I cannot verbally describe. I couldn't even put into words. But I can tell you this. If there's one thing that I can describe about this process, is that I'm happier today than I've ever been in my life with who I
That's
am.
what it's all about. That's what
Walking
it's
in
all
my
about.
own skin.
Right.
You know?
Yeah, you're living and breathing your 12th step. The 12th step is giving it back.
Absolutely, absolutely. And
So
you're
it's
100% right. Listen, if you're not happy in any regards with who you are and where you are, then something's not right.
That's correct.
And if something's not right and you're not working on a solution, unfortunately, you're probably the problem. But identification's a tough one. I mean, again, I'm a 40-some-odd-year-old individual, and I thought everything was fine, and I couldn't see where the measure up wasn't measuring up. But again, these resources are out there. Mr. G has hubbed them together on the www.recoveryliferadio.com site. I know he's taking calls directly on his 609-674-8810 phone number. So if you want to reach out to him and see what resources are available, and again, the website, we're working on it. Like everyone's life, it's a work in progress. So we have a lot of resources up there. We'd always love to hear somebody's feedback and what you think some other resources could be, if the resources are working for you, if you'd like to see other resources available. So Mr. G, he'll direct me, and we'd love to have as much help for people out there as possible.
Yes, we will. Hold on for a minute. We're going to take a little break. We'll be back with you shortly.
Thanks, Mr. G.
Thank you very much, Mr.
Yes.
J. and Rob.
Hi, my name is Jackie Crowner, Director of New Accounts here at Gospel 88.7 FM WEHA. I would like to tell you about our Let It Play for 36 a Day sponsorship opportunity. For $36 a day, your announcement can be heard by thousands of listeners here on Gospel 88.7 FM, 99.9, and don't forget about the World Wide Web. For just $36 a day, yes, $36, your announcement will be aired over 10 times per day, which will cover morning, afternoon, and evening drive time. Restrictions apply. For further information on broadcasts, sponsorships, and announcements, call us at 609-641-8870. Let it play for 36 a day.
Westminster Christian Worship Center, 9 South Chelsea Avenue, Atlantic City, New Jersey. Bishop Luke Witherspoon, Overseer, Pastor Juanita Witherspoon, presents their annual Fellowship Conference, featuring Sunday, March 15th at 4:30 p.m. Evangelist Jackie Witherspoon of Living Word of Faith International. Wednesday, March 18th, 7:30 p.m. Pastor Gloria Johnson, Grace Tabernacle Pentecostal Fellowship Church of Pleasantville, New Jersey. Friday, March 20th, 7:30 p.m. Youth Pastor Dr. Nicole Laus Belton of New Shiloh Baptist Church, Atlantic City, New Jersey. And Sunday, March 22nd, 2 p.m. Pastor Tammy Jones, Morning Glory Ministries, Atlantic City, New Jersey. And that's not all. Get ready for the annual Fellowship Prayer Breakfast, Saturday, March 21st at 9 a.m. Doors open at 8:15 a.m. Featuring special musical guests, Bishop Charles Laus and the New John Howard Gospel Caravan. All the way from Indianapolis, Indiana, the Williams Singers, WCWC Community Award honoree, Reverend Dr. John Howard Sr., and special guest preacher, Bishop Cedric D. Beard of Kingdom Life Church, DeSoto, Texas. Taking place at the Atlantic City Convention Center, 1 Convention Boulevard, Atlantic City, New Jersey. Conference Hotel Best Western, located at 701 Black Horse Pike, Pleasantville, New Jersey. To reserve a room, call 609-646-5515. The rate is $79 plus tax. Deadline for conference hotel fee is Saturday, March 14th, 2015. Reference code Westminster. Prayer breakfast donation is $50. Parking is $15. It's the Westminster Christian Worship Center Annual Fellowship Conference. You don't want to miss this.
Welcome back to Recovery Radio with Mr. G, where we are really having fun being clean and sober.
Absolutely.
Right now, what we want to do, I want to pass it to Robert R. and let him give you a little more detailed information about our goals and purposes. Mr. R.
Thank you, Mr. G. I'm Robert S., but I'll take Robert R. I'm an easygoing kind of cat.
I'm sorry,
it's okay.
I'm sorry.
It's okay, my brother. I got you. But so, really, the mission statement, what we're trying to accomplish here is to try to hub together exactly resources that can help people reach out for whatever their problems are. There's drugs, there's alcohol, there's depression, there's all kind of different, there's a litany of mental breakdown issues that people need help with. Obviously, we're not going to be able to touch on all of them, but we're trying to hub as many as we can put together that we're keeping it personal. We've had our own personal trials and tributes in life, so we've reached out to the resources that we have found helpful. And again, we have Michael DeMarco here because he's a professional in his field. He, working with the Crossroads Center, has probably, he has much more information than I have. And our purpose, why we're all here today, is to exactly give you the resources that we have found helpful for ourselves. And we've done that by hubbing that www.recoveryliferadio.com website with such services as a suicide hotline, John Brooks Center, of course, the esteemed Crossroads program, and other programs. But what I'm going to do is I'm going to pass off to Michael DeMarco here. He's going to give you some logistical information on exactly what, if you do reach out for services, how you can expect them to work and the process with the government and all that jazz, the .gov that you have, Michael. So what do you got for us?
Well, thanks, Robert. I wanted to talk about the Affordable Care Act through the current presidential administration, our executive level of government. It's still an open enrollment period for the Affordable Care Act, and the website is healthcare.gov. I don't know if people realize that this is because of the Parity Act. There's political movement towards substance abuse-related services with respect to the new line of insurances that are available to American citizens. Egg Harbor Township, Atlantic County, because of the casinos, is in a dire situation. I saw this morning that the mayor of Egg Harbor Township wrote a letter to President Obama citing that this particular casino-related closure situation, the way it's affecting the local economy of Atlantic County and Egg Harbor Township, he actually correlated it directly to Detroit.
Yeah.
Based on the Motor City and all the problems.
Motor City, yes.
And
Lack of jobs is definitely depressing.
Sure. So the federal plan has teeth. New Jersey has some local issues. Healthcare.gov, if people go to the website and enroll, there's a Medicaid plan now for those that are underemployed, partially employed, your part-time employee. An individual that makes at or near $16,000 a year has the ability to have free insurance. That free insurance is a form of Medicaid. Yeah, it's called the Alternative Benefit Plan, and those individuals at this time actually can receive treatment through that Medicaid plan without going through other channels. And they can use it for outpatient services for substance abuse.
That's why we need you here.
All this information is on that www.healthcare.gov?
Yes.
Oh, great.
Pull it up.
Locally, there's a nonprofit foundation, the Hope All Day Foundation.
Yes.
They're really only down the street. They're just down Tilton Road here.
We're going to reach out to them too, yes.
Yeah, I mean, they're across the street from Blue Heron Pines. I think they're the old Blue Heron Pines
Beautiful
East
facility.
Course. Absolutely gorgeous.
Beautiful facility.
And
Yes,
it is a nonprofit facility
Yes.
with the sole inspiration and mission of helping individuals in need with respect to substance abuse-related issues.
Yes.
The services there are free. They're open daily, I believe Monday through Friday, from 9 to 5.
That's
but hopeallday.net is their website.
Yes.
If you need additional
Please go
information.
to these websites.
Yeah. And they do an absolutely wonderful
A
job.
wonderful job. A lot of people that goes there.
Atlantic County government has 2 phone numbers for their substance abuse services, 609-645-5945 and 609-645-5932. And that's the Atlantic County Government Substance Abuse Office.
And why would I call that number? What would I find myself calling that number for?
Okay, if the funds are available through Chapter 51 dollars, which are basically taxes generated through beer, wine, and liquor sales, there's funding available for residents. They can actually give you an authorization number for inpatient if the funds are available, and they can refer you to outpatient facilities if your assessment deems outpatient services, if you don't need detox or inpatient.
Beautiful.
And so if you're indigent and don't have the funds, or you're eligible for other funds, they can send you to those
Direction.
agencies.
Yes, beautiful.
Yeah.
It's so nice. I mean, the more I'm involved in this process, and even this show right here today, the amount of resources that are out there. And I think that was our purpose,
That's the
Preppy.
whole purpose. Exactly.
There's so many resources out there, and just a short period of
Just have
time
to know.
ago,
Just have to know, man.
I did not know where they were.
That's exactly
So
right.
I think that is our mission, to try to hub together the resources that are available. And again, the resources, I put hyperlinks onto the website, so you bounce directly to the site, and you go directly to them.
Everything is on the site. Please pull it up.
We are just a hub, but I mean, Mr. DeMarco, I mean, sitting here once again, it's an amazing process. You try to help somebody else, and you find you're helping yourself the most. Being here today, I got a litany of information that was really, really useful and really helpful. And Mr. G, correct me if I'm not wrong. That
You're
is
never
it.
wrong, Mike.
No, my man. But that is the mission here. The mission is to hub together this www.recoveryliferadio.com with all of these resources. I'm going to add the healthcare.gov website, because as Mr.
we are.
DeMarco said,
That's a part of the recovery.
what a great
great-
program that's
yes.
out there. Again, I'm also going to add that hopeallday.net program, and we have some other resources. I'm going to yield to Dr. G over here, Mr. G.
Thank you so much.
Bring us home, my brother. Bring us home.
Once again, Mr. DeMarcus, we thank you for your patience and time. It's a privilege to have you here representing Behavior Crossroads, and we would like to have you back again.
Thank you.
Also, my friend and buddy, right-hand man, Robert
That's
B.
me.
Listen, I love you, and I'm
My
glad
honor.
that you're a part of this process.
My honor, my privilege.
Ladies and gentlemen, hour's coming to an end.
Okay.
I would just like to inform you that I would appreciate if you tune in again.
When are you here?
I'm here on Thursdays from 10:30 to 11 every week. All right? You've been listening to Mr. G.
If I want to get in
Recovery
contact
broker.
with you, Mr. G, how do I get in contact with you?
If you want to get in contact with me, a good question. Thank you for your sharpness. My number is 609-674-8810, or you can go to my website. The website is www.recoveryliferadio.com. Please open up the web pages, open up the website, give us a call, tell us what your concerns are, and we see if we can assist you in any way that we can. Again, we're so glad to have you as a listening audience today. We appreciate you being here with us, Doctor.
Thank you.
And Rob.
Thank you, Mr. G. It was my pleasure to come, and I'd love to see you again.
All right. You have been with Mr. G, your recovery broker, right here on your station for information, WEHA 88.7 and 99.9 FM.
Thank you, Mr.
Where
G.
we are people
Thank you very much,
helping
Mr. J.
people change their life. Thank you.
I love it. Thank you.